everyone, I'm Lila Abbate and welcome back to my YouTube channel. Today I'm going to talk a little bit about chronic constipation. Everyone seems to have it at some point in their lives. They say that $725 million is spent per year on over-the-counter laxatives, and it accounts for 2.5 million doctor visits per year. So when you think about it, you know, your bowels change, stressors, changes to your diet, traveling, things make your bowel motility wax and wane, and there's normals, so that's kind of okay. But what happens if you're stuck in a period where you just can't go to the bathroom? So of course you have to go visit your physician to figure out, is there something pathological? Is there something really wrong? And are your bowel patterns something that you're seeing as a significant change? So as a pelvic health physical therapist, I am determining if there's a muscle or a nerve problem that's contributing to your chronic constipation. When you have constipation and it's due to maybe stress, you can imagine that a stressful moment or being at work and having to do maybe a presentation or the phones are going a lot, whatever it could be, can just create your bowels to shut down. You know, you're traveling, you know, you get a 6 a.m. flight, which technically you're waking up in the middle of the night, 3 a.m. You know, you may not make a bowel movement that day, so things just sometimes change. So when they're changing and you're not seeing that you're getting the normal urge that you used to, people will reach out to laxatives. They'll do some maybe prune juice, which is a good thing to get, but then once you start moving into teas like senna, or laxatives like Miralax on the chronic and constant basis, then maybe you just need some other type of help. And if there's no pathology, no disease that's causing some of your symptoms, you may want to seek the help of a pelvic health physical therapist. So a lot of my patients complain they just don't get an urge. I have patients who have 3 sizes of clothing. I had one woman who didn't go to the bathroom for 21 days. She lived on a houseboat, and that was her husband's dream, and they were very happy, but in the end she had 3 sizes of clothing and she just couldn't poop. So my goal for her is never going to be to poop on the daily, because she can't even go within 21 days. So maybe I'm hoping she could just empty her bowels every 4 to 5 days. So we also have a common sense hat, like what seems to be the problem. A lot of people watch daytime TV. There's doctors on there and they're, giving people good information about water, fiber supplements, things that you need. But then if your bowels are used to moving every other day, and then a TV show is saying maybe you should go every day, sometimes patients just can't make their bowels move every day. So the common sense hat there is that my system works and it goes every other day, and that's your normal, and that's fine. So when you're not getting the urge, that's a problem. You're just kind of feeling full, you go to sit on the toilet, nothing's coming out. So sometimes we have to reconstitute urge within your system. We teach you maybe an abdominal massage in order to move the food around to kind of create an urge, things like that. But then we can also do something called biofeedback. So biofeedback gives us a window into your muscles and tells us what your muscles are doing. So we have a bigger program, and on the program you would put the sensor in, and then you can put your clothes back on. The wire connects to the machine, and then you can simulate defecation. Contract your muscles, relax your muscles, push down like you're making a bowel movement. And then we're watching on the screen to see what your muscles are doing. Should you need something to do at home, we can give you a home biofeedback unit, and you're working on maybe muscle relaxing or muscle lengthening. If you're not getting the urge after we've been doing this for a while, sometimes people do what's called rectal ballooning, and we're doing this with you in the clinic. You have gone and had some medical testing done. You've had maybe an anal manometry test, which has confirmed that you can't feel sensation normally. You could have had a very large baby 30 years ago, had a big episiotomy tear, and now you're just not getting normalized sensation. So don't get scared. This is ballooning. It gets connected to a syringe where it fills up. So we put it in deflated, and I just inflated it now so you can kind of see what the balloon will look like. And you're kind of getting the awareness, oh, I feel that. Some patients don't feel this, which is part of the problem. So when the stool is starting to accumulate within that sigmoid colon, that lower part of the rectum, the patients can't feel, and then there's no stretch receptor to give them the signal to poop. And sometimes that's what people lose. So we work on bowel retraining, whether it's with a little biofeedback sensor, whether it's with rectal ballooning, in order to help you reconstitute your urge. So you should only be sitting on the toilet when you feel like you really have to go. If you have to sit and strain and there's nothing there, it's never going to come out. So that's a little tip. And I'm Lila Abbate. Thanks for visiting my YouTube channel. Bye.